Hello, we are going to be comparing the healthcare systems between Australia and Brazil.
I'm Mariceli.
Charles.
My name is Chris.
I'm Nancy.
And I'm Sophia. So the four main goals of Australia's healthcare reform currently are to guarantee Medicare and improve access to all medicines through the pharmaceutical benefit scheme, to support both public and private hospitals, as well as making improvements to private health insurance. They also want to work on making mental health care and preventative health care a priority and increase the health and medical research investments. Whereas the main goals and priorities of Brazil currently are to create better access to prenatal care, decrease rates of morbidity and mortality from communicable diseases that can be prevented by vaccination, and lower the risk of mortality in the first year of life and maternal death. As you can see, these goals are pretty different compared to Australia's. Australia is just trying to better their actual healthcare system, where Brazil is trying to better the health of the nation. The health system and insurance scheme in Australia. So for the health system, for every 1,000 people, there are 11.7 nurses, 3.7 practicing physicians, 3.8 hospital beds, and 181 hospital discharges. And for every person, there is about 7.7 average physician visits. On the insurance side of Australia, there is about a little over $5,000 in healthcare spending per capita, 837 out-of-pocket health spending per capita, and $673 of spending on pharmaceuticals per capita. 100% of the public can receive public coverage for healthcare insurance, whereas they can also choose to have private supplementary coverage, which about 46% of the population elects to. And then the healthcare system and insurance scheme in Brazil is a little bit different. As you can see, people do spend less on healthcare, but there's also less practicing physicians, nurses, and hospital beds per every 1,000 people in Brazil. There's only 1.8 practicing physician, 1.5 nurses, 2.3 hospital beds, and only 55 hospital discharges per 1,000 people. But as pointed out, the out-of-pocket health spending is a little bit lower, and there's no current data on the spending of pharmaceuticals per capita. Similarly to Australia, there is an option for public coverage that everyone is able to opt into. So that covers 100% of the people through the unified health system. But there is an option for private coverage as well, and only 23% of people elect for that. So that's about half of the amount of people that elect for it in Australia.
The insurance system covers Australia by charging higher income households who don't purchase private insurance. 50% of Australians buy private insurance, and the government pays a rebate for the premium that they pay. Private insurance is also regulated by the Australian Prudential Regulation Authority. They also, as previously mentioned, created a public health insurance program, which is known as Medicare, which provides free hospital care coverage and pharmaceuticals. The insurance system covers Brazil by offering access to family doctors with no co-payment fees. Health insurance costs and health-related purchases qualify as a tax deduction. 70% of employees receive private health insurance as a benefit of being employed with them.
So what conditions are covered by Australia's Medicare? Well, conditions that cause any physical or neurological damage are covered, such as Alzheimer's disease, Parkinson's disease, serious bone fractures, concussions. Also things like hearing disorders and intellectual disabilities such as autism, cerebral palsy, spinal cord and brain injuries, blindness, and amputation victims. So what is not covered by Australia's health system? Well, such chronic diseases such as diabetes and peripheral heart disease are not covered. Also things like lower limb bone fractures, because the reasoning is that these kind of injuries will heal on themselves.
What conditions are covered and what conditions are not covered in Brazil. The ones that are covered are preventative services such as immunizations, primary health care, outpatient specialty care, hospital care, maternity care, mental health services, pharmaceuticals, physical therapy, dental care, optometry, and other vision care, durable medical equipment, including wheelchairs, hearing aids, home care, organ transplants, oncology services, renal dialysis, blood therapy, and stuff that are not covered are like prescription drugs. They offer a 90% discount on medication for dyslipidemia, rhinitis, Parkinson's disease, osteoporosis, glaucoma, contraceptives, and generic diapers.
So how is money raised for the insurance system in Australia? The public health system is actually funded through the government, and between the years 2015 to 2016, total health expenditures was about 10.3%, with 67% of that being funded by the government. Medicare is also a part of the public health insurance, and that's funded through the national tax system. Between the years 2015 and 2016, they were able to raise nearly 80.14 billion US dollars, with a share of it going to the National Disability Insurance Scheme. As for the private health insurance, this is government policies actually encourage enrollment through a tax rebate of anywhere between 8.5 to 33.9%. And this is all depending on the person's age and income. And there's actually an income-based penalty payment for not having private health insurance. And that's between 1 to 1.5%. And this is called the Medicare levy surcharge. And this only applies to singles with an income above $90,000 and families with an income above $180,000. Insurers are a mix of for-profit and non-profit providers. What about Brazil? Well, the public health insurance system here is financed through tax revenues and social contributions from the 3 levels of government there: the federal, state, and municipal. And the minimum contribution rates are shown here. The federal is that they have to contribute 15% of net current government income in from 2017, and that's adjusted for annual inflation. For the state level, it's 12% of total revenue. For the municipal level, it's 15% of total revenue. As for private health insurance, this is completely voluntary, and nearly 70% of beneficiaries receive it through their employers. And this is financed through Brazil spending about 0.5% of GDP on tax exemptions to help those pay for private health insurance. Additionally, in 2018, 84 partnerships for technology transfer were initiated, with 67 for medicine, 12 for equipment and medical materials, and 5 for vaccines. And this helped reduce costs by nearly 1.9 billion US dollars.
In Australia, there are various health services provided by many different specialists. General practitioners are trained to provide primary health care to patients of either sex and any age. The MBS model typically pays general practitioners each time they provide a service. There is also a practice incentives program wherein they receive funding on a performance-based initiative. Outpatient specialists deliver outpatient care in private practices. Just like general practitioners, they are too paid on a fee for service basis. 85% of the medical bill is covered by the MBS, and the specialists use their own discretion to determine each patient's out-of-pocket fees. In Australia, mental health care providers range from general practitioners, specialist care, community-based care, hospitals, and residential care. Mental health services are a responsibility shared by both the federal and state governments. In 2015 to 2016, Australian government subsidized an additional mental health services through the MBS and the PVS. On the contrary, in Brazil, since primary and specialty outpatient care is free to all, under SUS, patients do not have to make any direct payments to their providers. And in efforts of preparing the healthcare system, Brazil introduced the family health strategy. This is a model that promotes the use of family health teams made up of one doctor, one nurse assistant, and sometimes up to 12 community health workers. Most municipalities hire family health team members and set their salaries, which results in a wide wage variations across the country. In terms of outpatient care, the federal government reimburses states or municipalities according to the volume of specialist services provided. And similar to Australia, states they usually pay for specialist services on a fee-for-fee basis. The fees follow the national list of SUS procedures. And in closing, there are some similarities between the two countries and how insurance systems go about paying for health services, but there are also quite a few contrasts as well. In particular, patients in Australia are responsible for covering up to 15% of their outpatient fees, while Brazilian patients are not required to make any payments directly to their providers at all. And that